studies suggest that half of all women who die from homicide are killed by their current or former husbands or partners. In the United States and Australia, it is 1 in 3 women. UN Women estimate that as many as 70% of women experience physical and sexual violence during their lifetime, the majority occurring at the hands of husbands, intimate partners, or someone else the woman knows. An estimated 150 girls under the age of 18 suffer from some form of sexual violence each year. As many as 1 in 4 women experience physical and or sexual violence during pregnancy. Based on World Bank data, the UN concludes women aged 15 to 44 are more at risk from rape and domestic violence than from cancer, motor car accidents, war and malaria combined. In our beautiful Victoria in Australia, a very elegant, refined city, the women are more at risk from rape and domestic violence than cancer, motor car accidents, war and malaria combined. We need to change our medical curriculum, obviously. In fact, these women also, 7.9% of the burden of women in reproductive age, again in Victoria, are more at risk from medical issues than from raised blood pressure, tobacco use and increased body size. And how often is your doctor raved on about stop smoking, lose weight, when in fact they should be concentrating, are you at risk of violence in your home? There are many examples of gender-based violence, trafficking of women, as well as this currently gender-based violence is increasingly used as a weapon of war. Rape, sexual slavery, genital mutilation, forced pregnancy, forced abortion, forced sterilisation. There are also harmful cultural practices, terminating the female fetus, killing female babies, female genital mutilation, child brides who often end up with fistulas when they deliver a baby, dowry-related murders, 22 women killed each day in India, dowry-related murders. Good old violence just because of family honour and sexual purity, or the ideology that male sexual entitlement is what we should all be practising. Torture of widows in Nigeria. Medical Women's International Association, we are strong in academic medicine. We understand the need for data collection, research and teaching to improve the outcome for our patients. MWIA, as Shelley has mentioned, developed a manual to teach other doctors about violence against women. We understand fundraising for doctors working in low-income countries. Without money and supplies, how can the doctors look after these women? We support women doctors to achieve their potential in their career. If a woman doctor's career is cut short or stagnated, they will not reach their full potential, in which case they cannot care for these ladies. Much needs to be done to ensure the barriers to the advancement of women are removed.